see it come up. Hi everybody, and welcome to this really very special Facebook Live. My name is Renza Shabilia. I work at Diabetes Australia, and today I am joined by our CEO, Greg Johnson. But before we begin, I would like to acknowledge the traditional owners of the lands. We are in beautiful Wurundjeri land, and I would like to pay my respect to elders past, present and emerging. Greg, hello, how are you? I have been trying to get Greg on one of these Q&As for quite some time. He's leaving our organisation this week, so Liam, you need to mute yourself, please. Sorry, we have a little bit of, technology is great when it works, but we just need everybody else muted who's on this call. Thank you. Greg is leaving Diabetes Australia this week after working in diabetes organisations for 19 years and at Diabetes Australia for well over 10. Lucky Greg, poor Greg, lucky me, poor me, we've worked together for all of those 19 years. I think that we probably oscillate between the two. But Greg, welcome. Thank you so much for joining us today.
Thanks, Renza, and if I forget at the end, I've just loved every moment of working with you. Yeah.
Yes, my job is to not burst into tears during this, and I have very much enjoyed that too. We're going to talk a lot about that. You have done so much in your time working in diabetes organisations here in Australia, but also globally, because you've been involved in IDF and all sorts of other things as well, and in really important collaborations with other diabetes organisations, with industry, with government, all sorts of things. But I want to really focus today on the sort of things that you've done that have really elevated the voice and the position of people living with diabetes. So can you reach back to January 6th, I think it was, wasn't it?
A long way back.
Yeah, 19 years ago. I was at Diabetes Victoria. And when I look back now, I'm always so grateful for that opportunity, but it really was the definition of tokenism. It was like, we need to do something for type 1 diabetes, she's got type 1, she can do it. But what were your reflections of where the person with diabetes fit into the diabetes world in Australia at that time?
Well, firstly, in everything I say, I don't want to be critical of people at the time.
Of course not.
You know, because I know there are many people around now who I've worked with over that 19 years and who do great work. But I suppose my reflections on that is when I came into Diabetes Victoria in January 2003, and I hadn't worked in a diabetes organisation before. I'd had a couple of careers before that. A career in hospitals and being a big hospital CEO and running hospitals all over the country, and which was great. And before that, a hospital pharmacist and having a pharmacy career. So I came into diabetes, and what struck me was firstly that, and this was not a comment just about Diabetes Victoria, but about diabetes organisations more generally in Australia, that they were struggling. They were really struggling to deal with the epidemic, that was growing all the time. Everyone knew diabetes getting bigger and bigger, more and more people getting diabetes, and yet struggling, feeling overwhelmed as to how they were going to help everyone and support everyone, and seemed impossible. There were just so many people every day developing diabetes. We can't support them all. We don't have enough resources. We don't have enough of anything. And that was strong. And the second thing that was strong was, and because I was new, I just started asking lots of questions and talking to lots of people, lots of great people. And I started to realise just how big and complex this epidemic and pandemic of diabetes was then and is now, and it's growing. And I quickly realised that, it was far more. I suppose I'd come outside of diabetes, had this, totally flawed historical notion that there was juvenile diabetes that affected kids, and they needed insulin, and that was serious. And there was type 2 diabetes that affected old people and had to do with diet and what you eat, and it wasn't so serious.
That's what we all were told.
And I think I was guilty of that, but I quickly realised that was totally flawed and totally wrong. And I firstly set my personal standard to never do that again. And to never oversimplify diabetes, and to never think that one sort of diabetes was more serious and more significant or more important than another, or that indeed one person was more important. And And to do that, had to recognise firstly that so many different types of diabetes.
Right, yes.
And come back to your question, of course, I knew about type 1 diabetes, and but the organisations, what I found was Diabetes Victoria had almost nothing to do with type 1 diabetes. And it seemed to be, and maybe this is wrong, but it seemed to be that it sort of said, oh, well, type 1 diabetes is really a hospital thing, it's prosthetic, it's not, we can't do much about it. But it had you as a person with type 1 diabetes in the organisation to sort of, and I'm not sure what was really happening programmatically or strategically or about that. And then in regard to type 2 diabetes, it seemed to be that there was no consumer, there was very little involvement of people with type 2 diabetes, although there clearly were people with type 2 diabetes or in their families or themselves working in the organisation, but there was no real voice. And then, of course, the other types of diabetes, gestational diabetes and the other forms of diabetes were, seemed to be in the background of the system.
Yeah.
So I suppose the key thing that I set about for myself and the organisation was to first say, if this is truly an organisation for people, and so the thing that I loved, that I really loved at the time, and I still do, is I personally knew, even through my family connections, a great endocrinologist who's now passed away called Hal Bryden.
Oh, yeah. Yes.
Some people know Hal, and he worked at the Alfred Hospital in Melbourne, a great endocrinologist. He'd been involved in the formation of Diabetes Victoria, Diabetes Australia, and the international. He's a great man. But I knew him personally through family contacts. Yeah. And so he told, and I knew the story that in 1953, I think it was, when Diabetes Victoria was formed, Charles Best, who was one of the co-discoverers of insulin, had come to Australia. Yeah, there was this group of people sat around the Melbourne Town Hall at a table and said, we need a diabetes organisation, let's form one. Yeah. And they did. Yeah. And that became Diabetes Victoria. And of course, that story is told across the country with the formation of state-based and local diabetes groups and organisations. But that was all about giving voice to people. Exactly right, yes. And having organisations. So coming back to your question, if Diabetes Victoria or Diabetes Australia was going to truly give voice to people with diabetes, firstly it had to have them in the organisation, had to listen to them, and it had to give them a platform. Yeah. And so I think in simple terms, that's what I've tried to do. Yes. And while, you've personally been a big part of that at the local level, at the national level, and indeed at the international level with many things we've done, but there's lots of other people. Yeah, of course, yes. And I think that's, I'm leaving at the end of this week, and it's really sad, but I think one of the things that I feel really good about is that I know that around the world, Diabetes Australia and diabetes organisations in Australia are regarded as leading in this area of really finding ways to give voice in really meaningful ways and constantly changing that. It's not a static thing. And that works in many, many ways, but I think, I think that's real now. Yeah. And hopefully that will grow and endure. Yeah, and I think that one of the things that is so critical in what you just said there is that, I get to do these Facebook Lives and I get to, speak at things, but it's never been about one person. I remember, there's no such thing as a poster child for diabetes. And one of the things I've really appreciated is the way that depending on what it is that we're doing, that we go to that target group and engage there. So I have type 1 diabetes. I was diagnosed at 24. I can talk about my experiences there, but I can't speak about somebody diagnosed with type 2 diabetes who's older or younger or gestational diabetes. But we've really found a way to be able to connect with people to make sure that we're hearing from them when we need to. And that's something that is just, that's part of everything. It's part of our comms. It's part of everything we do. And I think that that's so important. We're sitting in a room, it's our boardroom in our Melbourne office, and you can't see what's over there, but there is something from the Australian Centre for Behavioural Research in Diabetes. Let's talk about mental health and diabetes, because that was something else that when you started, no one was really talking about that. And again, this isn't a criticism. This was just the diabetes landscape then. That's what it was. But you changed that
as people started saying, hey, this is more than just what our HbA1c is. Yeah.
Yeah, and that's true. Again, you know, we could talk about prevention, we can talk about mental health, but back in 2003 when I started, there were a whole lot of things that just weren't on anyone's agenda. Like they weren't, and fortunately the world's moved on, and certainly Diabetes Australia's moved on. So I mean that was a really big thing to me, was that it was obvious just how difficult diabetes. One of the things that I did, I still remember in the early days when I started, I thought I have to get out there and I have to talk to people. You know, I just have to. And I remember I used to have the discipline in my first couple of years of every month I would go somewhere out of Melbourne into country Victoria. And I remember driving to Sea Lake.
Sea Lake.
Sea Lake. I went to Sea Lake.
Tell people where Sea Lake is in case they don't know.
So Sea Lake is a tiny little village in Western Victoria, in the middle, you know, very, probably 3.5 hours, 4 hours drive from Melbourne. I think there's only a few houses, but there's a diabetes support group in Sea Lake who invited me to speak with them. And I got there and there were 3 women who lived in Sea Lake and had a diabetes support group, and it met monthly. And I'd driven, you know, if I was the first person from anyone to ever go and visit them. And I had a nice cup of tea and think, whatever.
It's gone, I'm sure.
It's gone, I'm sure. And, but it, you know, that's an example, and I went to many other places and around Victoria, and over the years I've had the privilege of going to lots of places in Australia and talking to people with diabetes. And the thing that's resoundingly true, whether you're talking to a person with diabetes or a family member, is they do their best, you know, to live with this thing and manage it, but it's tough. Both the resilience and strength that's needed was obvious in some people that they developed it, but you know, it wasn't really recognised. And so that was one of the things that I started to develop my thinking about, and for Diabetes Victoria in the early years. And as a result of that, we set about, and I suppose the other thing was in research and understanding and how you develop understanding about this. I realised that I was living in Melbourne, which has world-leading researchers in immunology and in all sorts of areas. Great, amazing people in Melbourne. I wonn't name any of them because I don't want to. But, you know, world leaders in diabetes research. But there was this big gap. And the big gap was we didn't really have anything much to do with research and developing understandings around mental health in diabetes, around diabetes-related stress and distress, around the stigma and discrimination. We had people who thought about it. They knew that there was discrimination because over the years, of course, we had people who had been advocating against the discrimination that was so rampant. But there was research was missing and gathering evidence that would be powerful to change that. So I had the privilege of helping form the Australian Centre for Behavioural Research in Diabetes with the support of Deakin University, who've been a great partner. And I want to acknowledge that. And recruited Professor Jane Spate, who's been over 10 years now in Australia and came to the UK, and we're great and very fortunate to have Jane and her leadership. And that's been a great thing. And then that's helped us develop both an understanding, but also translate that understanding into action around things like the stigma and discrimination, the diabetes-related stress and distress, how to understand that. We know there's a lot of it, how to best prevent it and manage it and do things about it. And because it's not just depression. I mean, there is depression, and that's at one end of the spectrum, but there's a lot of anxiety related to the day-to-day burden of diabetes. And of course, that then translates into our, as you know, our advocacy and our communications and working with great people like Taryn and others in our communications team to develop public education campaigns that have called this out and said, this is a serious problem. And most recently, you were just talking about giving voice to different target audiences, but I remember in this very building having a young boy,
Yeah.
and I've forgotten his name
Jack.
actually, Jack,
Yeah.
and Jack telling his story about how he was hurt.
Yeah.
You know, he was hurt by the way, and the stigma of diabetes was affecting him.
Mm.
And he had the, you know, the guts to challenge that and
Yeah.
call it out. And that's one of the most amazing things to see.
Yeah, what an
It's really
incredible
powerful.
kid. Yeah,
What an incredible
absolutely.
kid.
Yeah.
But it's also such a privilege to be in a position where you can give voice to, you know, to that.
Yeah. Yeah. Oh, what a gem Jack was. He contacted a radio station after they made a stigmatising joke about diabetes,
Yeah.
and I just, you know, all the power to him for doing that.
Yeah.
But I think what's really important is that not everybody has that, you know, knows how to do that or wants to do it or feels resilient enough to do it. But there is now actually something that you can fall back on that says, actually, no, the way I'm feeling is legitimate. It's understandable, and there's
opportunities, particularly with digital, social media and things, that people can connect a lot more.
Yeah.
And we've had, you know, we've been really fortunate to sort of lead the world in raising some of these issues, understanding them, raising them, putting them out there in the ether, you know, so they're in the social media, and having people all around the world engage. It's amazing, you know.
Yeah,
I've always thought, I've aspired and for Diabetes Australia and Diabetes Victoria for that, to be a leader, and what that meant to me was not about having you know, some big titles and big role. It's about change.
Yeah.
You know, being a leader in diabetes is really about challenging and changing.
yes.
And in the right way, with good understanding and working in partnership with lots of people, but wanting to change things for the better.
Yeah.
And, you know, one of the key ways to change things is to get out there and talk about them. And that's the other reflection on the journey over 19 years is, 19 years ago, there were no, you know, we didn't have people who had the skill to go out there and, you know, get us onto television.
Yeah, yeah.
You know?
Yep.
In fact, I can remember when I started, there was no, I mean, it was sort of like everyone, we were frightened. The organisation was frightened.
Yes.
Was scared of talking.
That's right.
Was scared of talking to the news. If the newspaper rang up or the television cameras were like, oh, you know, we don't want to go there, right?
We might say something wrong.
We might say something wrong and we might get criticised.
Yeah.
And so that was one of my first actions, was to change that and say, no, we need to be out there. We need to be out there talking about diabetes, just like people are out there talking about cancer and talking about, you know, unless we're out there talking about it, we're forgotten.
Yes, absolutely.
And then not only talking about it, but we have to be talking about it in the best way, the most informed way, and a way that changes things for the better.
Yeah, absolutely. I can remember your first TV interview. I remember that.
It was probably appalling.
It was terrible, Greg. But what I remember wasn't that bad. But what I do remember was there was all this sort of flurry around the office, and our comms manager was, you know, desperately trying to do some media training, and it was fine. It's just you're far more experienced now. I think that's one of the things. Don't be afraid to be talking about diabetes, and it is something that. And if people come back at us, we have to keep going, and we have to keep talking about it.
And so that fear, you know, we had to say, no, we can't be afraid of talking, and so that's journey's led us now to where we've, as you know, put out the world's first language position statement over how many years ago?
10 years ago.
10 years ago,
anniversary,
which called out language.
Yeah.
You know, called out all of this poor and language that contributes to stigma and blame and shame and those things. And that's had an amazing impact.
Yeah, nice.
And people around the world, we've now seen language position statements in many countries.
Yeah.
And you know, you get to talk about that, but it's real. It's absolutely real that and it isn't just about one type of diabetes or one particular group that's
Yeah.
loud and proud, so to speak. It's really about all diabetes and everything, which is good.
Yeah, we might share a link. We had a summit about, there's a global summit just 2-3 weeks ago now, where we actually involved people from around the world who were talking about diabetes and language. So we might share the link in the comments. And also, that's one thing I forgot to say at the beginning. If you have a question for Greg, now's your time to say it. In fact, you ask it. You have to kind of do it now because he won't be here beyond this weekend. So now's your time. I think one of the things that's really important, though, is around those sorts of documents, those policy papers that we put out, because that's not just us. We're not just writing them and saying, this is it, off you go, everybody has to do it. They're done in collaboration with lots of different partners. So absolutely people with diabetes, obviously, but also we work with the Australian Centre for Behavioural Research. We work with health professionals as well. How important is that to have those sorts of collaborative efforts?
It's incredibly important. Again, come back to that fear that we talked about, that I experienced early on, was in part fear from internal criticism. You know, that you might get something wrong. You might actually not say the exact right definition of type 1 diabetes or type 2 diabetes. And what I also found is that there was a lot of angst and a lot of internal argument that was really wasted effort with people in the diabetes community. You're being very focused in the diabetes community, and oh gee, who's going to say what, and we better get that right. Whereas now it's much more, we're all working together in partnership, and we're out there talking, and we do align. You know, we have partnerships that Diabetes Australia has with all leading health professional experts and bodies. Some of that's really very, very close, like with the Australian Diabetes Society and the Australian Diabetes Educators Associations, who are affiliated members and really close, but also many others, in the JDRF and the Paediatric Endocrine Group and the Diabetes in Pregnancy Society and the College of GPs and lots of them. And we work with everyone. The other thing that does is help align the message. And so, but to come back to, I think the answer to your question is, one of my presentations, I sort of use these E words to say what's the keys to success in this. And one E word is evidence. You know, you do have to have evidence for what you're saying we need to do, evidence for what the problem is, evidence for what the solution is, and not just an opinion. You know, particularly in this day and age with social media, the world's full of people with fiercely held opinions. Everyone's got an opinion, and some of them are really loud. But you've got to, you know, we've got to have evidence. And to do that, we have to work with people who produce some evidence and understand it and have their support. The second, another E though, is emotion. And if we don't care, and if the people out there, if politicians or the community doesn't care, we won't get anywhere. You won't get any change. So there has to be emotion. The emotion. We need to be emotional. And we want to make people care. That's emotion. People sometimes get confused with that, think, oh, you know, that emotion is somehow not evidence-based. No, you can be evidence-based and you can use emotion and it be emotive. And that's really important.
And that comes from experience. And I think that's the whole thing. That's the heart and mind story that I love telling, is that's when things become so powerful and so difficult to ignore, is when you've got that evidence and that's satisfying the head, but you've also got that emotion and the experience, and there's your heart. And it's really hard for anybody to go, nah, we don't believe that when you've got that.
And, you know, over the years we've done so many events in the Parliament House in Canberra and things all over the country, and always we try, the principle is we have to make people care.
That's right.
You know, so if you're talking about the seriousness of diabetes or a complication, it's not about scaring people, it's about people caring.
Exactly.
Not scaring, caring.
That's so true. And I think that's one of the things that we've really moved away from, are those scare tactics that for so long, and this is a global thing, and it's not just diabetes, but it is that, you know, let's shock people because we know that'll make them do something, whereas actually that wasn't necessarily the case, was it?
Yeah, if you think about some of what we've done, it's great. I mean, the work in the area of foot problems and amputations, and we've had the Get Your Socks Off campaign, which is sort of lighthearted. We've had politicians all over the country taking videos and getting their socks off. And it's lighthearted and about a serious issue, but it's important because in that process we get those politicians to understand that this is a serious problem and get them to go and talk to their local health hospitals and providers and say, what are you doing about diabetes?
Yeah.
And all of that makes a difference,
Yep.
you know.
Yep.
So, you can get across your message in many, many different ways. And
Yes.
indeed, using humour and being, is a really good way to do that.
Absolutely.
Often.
And I think that's really important, actually. And it's a conversation I often have with people when I say, diabetes is really serious and I struggle with it a lot and I hate it. But sometimes actually I do need to laugh. And that's part of that peer support thing, is poking fun of each other in a very gentle and kind way. There's no malice behind it, but just, silly things I do when low and all that sort of stuff is that's how you connect with others and gets you through the day, I guess. You've touched on working with MPs and with government. Now, you've worked your way through lots of health ministers and departments and all of that. But I think one of the things that I know from having worked in diabetes for so long is that diabetes has a far more prominent position in terms of the health space than it did 20 years ago. How hard was it to sort of muscle in, because there is so much noise, there are so many other health conditions, everyone's jostling for the ear of the health minister or the ear of the Department of Health. How hard has it been getting in there, and how has it been that where the diabetes is now so, on everyone's radar?
Well, it's like everything. I think there's no single answer to that. And most things are all complex, and most things have multiple things you need to do. And it's always my response is, don't ever ask me what's the one thing about diabetes, because I'll say that's the wrong question. There's many things you need to do. It's a bit like the story about someone was interviewing someone who'd won a Nobel Prize and said, well, how's the key to winning a Nobel Prize? And it's getting that fantastic idea. And he says, having lots of ideas.
Right, okay,
So it's the same thing. To address a big, serious, complex thing like diabetes, we have to do many things, not one thing. So having got that off my chest,
good.
I think that the talking and communications that we talked about before, about getting over the fear and getting out there into the community, having public awareness campaigns, public education. People sometimes do get confused and they think that the information or the campaign or material that Diabetes Australia might be putting out there is for people with diabetes. Often it's not.
It's not,
our target audience is not people with diabetes. It's not their families. We do that work, but we know they care about diabetes. What we've got to do is make the other people care, the people who don't think about diabetes or think they know about diabetes and really don't. So what they know is wrong, and we need to change that. Or they don't care at all. And that includes politicians, and it includes people, leaders in the community, and people who run big companies and organisations. So getting out there, having campaigns and communications, having position statements on things, and pushing them out there and talking about them is really important. And that all adds to how diabetes has grown in its voice in the federal parliament and in the states.
Absolutely.
The other part of it is you've also got to have the skills in policy development. That is, it's not enough to just say, here's a big problem, diabetes, please fix it. Because the next question is, okay, we accept this is serious, we accept this is a problem, what do we do about it?
Where do we start?
Right? And you have to be able to develop with experts and with people, with partnerships, proposals, propositions, programs. Sometimes you put those forward for elections, sometimes, but it's a process. And you often do that with departments of health and people in roles whose job it is to develop those programs, develop those possibilities that can then be funded. And one of the things that I think, again, I feel good about, and I've been, pretty successful at, is that process, raising the issue, having campaigns and communications about the issue. We take the example of vision loss and blindness. You've had your eyes checked, your diabetes eye checks for years and years and years. But we know that more than half of all people with diabetes, any kind of don't have their eyes checked as they need to for diabetes eye check. So we knew the problem. We then communicated about that loudly and often in lots of campaigns. We then worked with Vision, the eye sector, with Vision 2020 Australia, Optometry Australia, eye experts, the Centre for Eye Research, everyone we could talk to, and said we need. We looked to other countries, and we found that in the UK there was a diabetes eye screening program. We brought the leader of that to Australia to speak to the federal health minister. You do all of that work. Then we designed a program that could work called Keep Sight. It wasn't called that originally. It was
something different, wasn't it?
And then eventually we got that funded, and now over 200,000 people. Over 200,000 people are enrolled in that program as we speak, and that'll grow and grow and grow. And that's a fantastic thing because that's going to make a real difference to preventing vision loss and blindness in Australia.
We're going to put a link to Keep Sight. If you have diabetes and haven't registered, it literally takes 2 minutes, and it's a recall and reminder system, so you will get reminded when it's time to have an eye check. And there's so much to do with diabetes, we forget. It's completely understandable that we forget these sorts of things. So this is a great way that you get a message to remind you to make that appointment. It sounds so simple, but and it really does. But the way I describe it, it's sort of, I need a PA for my diabetes, and this is at least one thing that is, I feel somebody is remembering for me. Then I just need to pick up the phone and make the appointment. So that's
and that sort of links to another key theme in this, which is often people try to bundle everything together in diabetes, and it's overwhelming. It's overwhelming. Remember, it's not only overwhelming for you or a person with diabetes, it can be overwhelming for a decision maker. Right? If there's too much asks too many things. So that's why breaking it down and thinking about it in priority areas, and that's what strategic plans are about. And of course, these things can take a long time to get traction and to get attention. And a lot of things come and go, get funded by governments or get funded by some benefit. So there's too many projects and too many things that come and go. So that another one of my key objectives has always been not to start something and have it stop.
It's going to be sustainable.
Sustainability, consistency. Not chopping and changing every week or every year from one thing to the other, but having, and then you can break through, and then you can get some sustained things. And we've been fortunate to have a sustained National Diabetes Services Scheme in Australia now for over 35 years. Coming up to 35 years. And what an amazing thing that is. Great. And there's challenges with that, but that's a great scheme that doesn't do everything, but it does really, provides really important support for all people with diabetes in Australia.
Absolutely. We can't talk diabetes, and especially when we talk diabetes technology, without talking about the CGM initiative. I like to refer to that particular, we have this program now as part of the NDSS, but gosh, it was a slow burn. We started talking about that and lobbying and really trying to look at how people could be supported with CGM when CGM first came into Australia, which is well over 10 years ago now. It's close to 15 years since we've had CGM. The initiative doesn't support everybody with type 1 diabetes, and we know that. And it's probably one of the questions that we get most. But let's talk about the success of that and what happens next as well. So can you, what are your reflections of how we got to where we are with that initiative, which is supporting 50% of people with type 1 diabetes to have access? Not everybody, not all of those 50% do, but they are eligible.
So I suppose you use the word slow burn, and that's important to remember. Whether it's CGM access or whether it's prevention of type 2 diabetes or whether it's something else, vision loss, blindness, generally in Australia, in our system, we do have a complex system of governments, Australian government, states and territory governments. They don't always agree, who would have thought? And so often, there'll be debates and disputes about who should pay for what in health. And that can happen at any level in diabetes and different things. Secondly, things take a long time. Often they take a long time. The important thing is, as I said before, that not to stop and start, not to have, something. We are on a journey here, and it's always a journey. In any area of diabetes and health, it's a journey. The great thing is that we have the current federal government, and I have to thank them for this. There's a $300 million 4-year commitment to this CGM initiative. That's a lot of money. Right? and that is continuing to see more and more people with type 1 diabetes access free CGM, free.
Right. Yeah.
No co-payment,
Yeah.
free.
Yeah.
Right? And at the moment, that's over 40,000 people, I think, at last count,
Yeah.
have actually accessed.
Yeah, that's huge.
That's a lot.
Yeah.
Now, so we've gone from no subsidy, no government program in April 2017,
Yeah.
1st of April 2017,
Yeah.
to now, 4 years later, over 40,000 people have accessed. More than that still have eligibility and can access.
Yep.
Of course, newly diagnosed people and young people with type 1 diabetes and others can get access, so it's ongoing and evolving. And there will be further, I'm sure, there'll be further expansion of eligibility. It's like everything, there's not there's many things competing for government attention for more money. But we're on a journey here and it's growing. And that's a good thing.
Yeah,
right?
absolutely.
And of course we've got to recognise that the rapid change of technology, this is not a static thing. New things are coming, so we have to work in an environment where we're not only saying, and we have seen evolution, we've seen flash glucose monitoring added to that scheme. It hasn't been static. We started with under 21s, we then went on to add pregnancy diabetes. We've added flash glucose monitoring step by step. There'll be another step and another step and another step in the future, in the next few years. That's good.
And I know every time there has, when it started, but then also with every iteration of it, we have very clearly communicated we're not done yet. It's not, we certainly always do celebrate these wins and these successes, but then that lasts for a very short time because we're back in it because there's just so much more to keep doing. Yeah.
And it is stepwise and incremental, but that is how most good sustained programs are. They're not, and understandable. You can't introduce a program and have all the settings right then and just keep it going forever. It doesn't work. Things change, new technologies come along, things change. So the good thing about the CGM initiative and many of the things we do in diabetes and we've been involved in they evolve. The diabetes in schools program.
Of course.
Another great thing, and that will evolve.
But we didn't have anything only a few years ago. Now we have a nationally consistent program supporting all school-aged children. Now, something people might not know about you, although a group do, is that one of the things that you like to do is get on a bike, go for a bike ride. And for a number of years, you used to do the Murray to Moyne. We're going to need to explain this because I know that it's not only Victorians and certainly not only Australians who are watching this, but so you did the Murray to Moyne bike ride, which was 520
kilometres.
Right, okay. And you were part of a team called Hypoactive. Tell us about that. Because I thought Hypoactive was a support group that's been around forever. It's still going. Unsurprisingly to anyone who knows me, not something that I've been particularly involved in, but it's all about type 1 diabetes and exercise. And they used to field these teams to do incredible, different initiatives or sports activities. And one of them was the Murray to Moyne. How was that riding with a bunch of type 1 diabetes riders?
Well, it was great fun, although sometimes it could be dangerous. So how that started was when I was with Diabetes Victoria and early on, and I loved bike riding and I've always done bike rides and things. And I think a woman, Monique Hanley from memory, Monique. And Monique came to me and she was part of Hypoactive in this group, again, a self-formed diabetes support group, people with type 1 diabetes, physical activity, but they were really into physical activity. And I think Monique went on to do the Ride Across America.
She did, so she was in that, in the first Team Type 1, and she was part of that. And there are still cards, I've still got one, cards with Monique. Swap cards, and I still speak with her. She continues to be a remarkable woman, but she started Hypoactive, and that model was then imitated in other countries as well.
So it was, this is a long time ago. I thought, I love bike riding, so I'll go for a bike ride anywhere. And B, how interesting is this? So off we go we sponsored and helped Hypoactive do this ride. This is a ride over 24 hours, and you have to start and ride overnight and in the dark. You need support vehicles, you need safety and things. And it's group ride, we could have 20 riders on the road. They had, obviously, most people with type 1 diabetes riding. some they had variously at different rides. That was when I first got to know CGMs, because some of them were using CGMs.
She was.
And monitoring it was fantastic to see, what's going on with this endurance ride and with exercise and different activity for different people. And it made me reinforce the fundamentals that everyone's different. Yeah. Everyone's different in diabetes. Everyone with type 1 diabetes is different. Everyone with type 2 diabetes is different. And so, one size doesn't fit all, and the variability is amazing. And one ride we had the sniffer dog, the hypo dog, with us. Right. So little dog sniffing around and smelling the ketones, and that was it. And we'd stop along the ride sometimes and talk to people in little towns in the middle of nowhere about diabetes. And I remember one time going into a pub in the middle of nowhere because there's nowhere else to go for a drink, and talking to people around the bar and say, we're all riding for diabetes. And here's the so telling people about diabetes. And so it was a great thing. It's just another example of and also breaking down barriers and making people realise that diabetes, you can have type 1 diabetes, you have any type of diabetes, and do this. You can do. There's been Olympic athletes with type 1 diabetes, gold medal winners, Malik Hanley cycling across America. People with type 1, people with diabetes can do anything, but the technologies can be a great help and life-changing in that. Getting out there and being supported is really a great thing too.
I think that's probably a really lovely way to end that. I always was so interested to hear about the Moyne. It was a fundraising initiative, and
we raised money as well.
We raised money, but I always just, that endurance, I like the idea of doing that sort of endurance activity with diabetes. As someone living with diabetes, just still astonishes me. But Monique really started something amazing, and Hypoactive is still going. They're active on Facebook, and probably not to the degree that they were 15 years ago. But how wonderful that you were part of that. So, Greg, very, very sad that you are leaving. I'm going to read something out to you though, because we've had some really lovely messages from people because we promoted that we were doing this, and somebody said this, that they're very sorry to see you go, and that in the last few decades that you've stood out for being focused on advocacy for people with diabetes, and I feel like that's, you haven't done that though. I think what that has done is that not only has it meant that people with diabetes are more centred in these conversations now, but it means the efforts around collaboration are more important and happening. So we see that as part of research now, there will be a advisory group for people with diabetes. At the Australian Diabetes Congress every year, there are, we have our DA people's voices. But it just, and all of those things when they start, there still is that element of fear. I know that there still is in the community. I know I certainly feel it. But I do remember coming to you, and I was just a little finishing up story and saying to you, this is in 2012, and saying we need to run a social media summit. And you said, what, social media, what is this thing? And there was a massive diabetes online community that I was part of and that I could see was great, but we needed to really make stand our foot here in Australia and say we're here. And we brought somebody from the US over, we brought Kerry Sparling over to keynote it. But I remember you saying, well, what are the risks around this? And I'm like, well, we're going to be giving people with diabetes who have access to a huge number of people through their followers free range to say anything they want, including anything about us. And you went, okay, let's do it. And we did, and it was hugely successful, but I was quite anxious and nervous about it. But it was just another step, I guess, in making sure that we were going to where people were and reaching them, whether that be in Sea Lake or whether it be on Twitter. And that's
there's sort of been a theme in this discussion about fear and getting over the fear. And I think that's important for all of us, and getting over the fear of putting yourself out there and putting yourself, you have to take risks to make big progress sometimes. And that's what I've tried to do and enjoy.
Absolutely. Well, thank you.
And I've loved every day of it.
Oh, and, good. Yes.
And I will miss it. Miss it a lot. And particularly, really valued what you, Renzo. It's been great fun all the way through.
Okay, we'll stop there. thank you to everybody who has watched. We are so lucky. Your legacy will be here for a very, very long time. We are very lucky as people living with diabetes to have had such a champion in our corner. I'm thrilled to say that you'll still be doing bits of diabetes in your new role, so you're not free of us. And thank you very much and good luck. Thanks to everybody who has watched. Please share this with anybody who you think might like to see it. I get brownie points for not besting his cheers. I'll do that as soon as Liam ends the broadcast. Thank you, everybody. Bye-bye.